Listen closely. If you're a man over 50 struggling with weak erections, low energy in the bedroom, or that frustrating inability to perform like you used to, what I'm about to share could change everything for you starting tonight. I'm Dr. Jennifer Blake, a board-certified urologist with over 20 years of experience treating men's sexual health issues, and I've discovered something that the pharmaceutical companies don't want you to know about. A simple drink that costs less than $5, takes 2 minutes to prepare, and has helped thousands of my patients restore their masculine vitality without a single prescription pill. Most men over 50 are suffering silently with erectile dysfunction, believing it's just a normal part of aging, but you don't have to accept this. The truth is, your problem isn't low testosterone, and it's not psychological. The real culprit is hiding in your blood vessels right now, choking off circulation to the one area where you need it most. Stay with me for the next few minutes because I'm going to reveal exactly what this remedy is, how to make it, and why it works better than Viagra or Cialis ever could. Before I reveal this simple solution, you need to understand what's really happening inside your body. You see, erectile dysfunction isn't actually a penis problem, it's a vascular problem. Inside your penis, there are thousands of tiny blood vessels, arteries, and veins that need to rapidly fill with blood to create and maintain an erection. But here's what happens as you age. These blood vessels become clogged with arterial plaque, inflammation, and calcium deposits. Think of it like the pipes in an old house. Over time, mineral deposits, rust, and sediment build up inside the pipes until water can barely trickle through. Your penile blood vessels work exactly the same way. When these vessels are clogged, blood simply cannot flow into your erectile tissue fast enough or in sufficient volume to give you a strong, lasting erection. Even worse, this plaque buildup doesn't just affect your ability to get hard. It damages something called your endothelial function. The endothelium is the thin layer of cells lining your blood vessels, and these cells produce nitric oxide, which is absolutely critical for erections. Nitric oxide is the molecule that signals your blood vessels to relax and dilate, allowing blood to rush in. Without adequate nitric oxide production, your blood vessels stay constricted and rigid. No amount of mental arousal or physical stimulation can overcome this physical blockage. This is why so many men tell me they still have desire. They still want to be intimate with their partners, but their bodies simply won't respond. The blood flow just isn't there anymore. Now, let me explain something else that's contributing to your problem. As plaque accumulates in your penile arteries, it also triggers chronic inflammation throughout your entire cardiovascular system. This inflammation further damages your blood vessel walls, creating a vicious cycle. Inflammation causes more plaque causes more inflammation. Meanwhile, your body's ability to produce nitric oxide continues to decline year after year. By the time most men reach their 60s, their nitric oxide production has dropped by more than 60% compared to their 20s. Add in the effects of a Western diet high in processed foods, sugar, and bad fats, and you have the perfect storm for erectile dysfunction. Your prostate health is affected too. An enlarged prostate, which affects nearly every man over 50 to some degree, puts pressure on your urethra and affects urinary flow. But it also impacts the complex network of nerves and blood vessels around your pelvic floor that are essential for sexual function. Everything is connected. Poor vascular health leads to poor prostate health, which leads to poor sexual performance. And here's what makes me frustrated as a physician. Most doctors don't address the root cause. They simply write you a prescription for a pill and send you on your way. So why are conventional solutions failing you? Let's talk about Viagra, Cialis, and all those other ED medications. I've prescribed thousands of these pills over my career, and yes, they can work temporarily. But here's what the pharmaceutical companies don't advertise in those commercials, with couples dancing on the beach. These drugs are band-aids, not cures. They force your blood vessels to dilate for a few hours using synthetic chemicals, but they do absolutely nothing to remove the underlying plaque or heal your damaged endothelium. The moment the drug wears off, you're right back where you started. And the side effects? Headaches, facial flushing, back pain, indigestion, and in rare cases, dangerous drops in blood pressure or even vision problems. Some of my patients have ended up in the emergency room because they took these pills with other medications. Not to mention the cost. Without insurance, a single Viagra pill can cost $40 to $60. If you want to be intimate twice a week, you're looking at $400 to $500 every month. That's $5,000 a year just to have a sex life. It's absolutely ridiculous. Then there's testosterone replacement therapy. Now, I'm not saying testosterone doesn't play a role in sexual health. It absolutely does. But here's the dirty secret about testosterone injections and gels. For most men with erectile dysfunction, low testosterone is not the primary problem. I've tested thousands of men who complain about ED, and the majority have testosterone levels that are within normal range. Even for those who do have legitimately low testosterone, replacing it doesn't fix the vascular damage and plaque buildup. You might feel a bit more energy and libido, but if your blood vessels are still clogged, you still won't be able to perform. Plus, testosterone therapy comes with its own risks, including increased red blood cell count, sleep apnea, prostate enlargement, and potential cardiovascular issues. Some studies have even linked it to increased heart attack and stroke risk in older men. And again, it's expensive. You're looking at hundreds of dollars per month for the rest of your life. What about vacuum pumps and penile injections? I've seen men try these options out of desperation. Vacuum pumps can mechanically draw blood into the penis, but they're awkward, unromantic, and uncomfortable. Many men find them embarrassing to use. Penile injections, where you literally inject medication directly into the side of your penis before sex, can be effective, but think about that for a moment. You have to stick a needle into your penis every time you want to be intimate. Most men can't handle that psychologically, and there's a risk of scarring and priapism, which is a painful erection that won't go down and requires emergency treatment. These are desperate measures that still don't fix the underlying problem. After treating thousands of frustrated patients and seeing the limitations of conventional medicine, I started researching natural compounds that could actually address vascular health at the root level. I spent months reviewing medical literature, ancient healing traditions, and emerging research on phytonutrients and cardiovascular function. And that's when I discovered something remarkable. A combination of ingredients that, when mixed together in a specific way, creates a powerful drink that naturally dissolves arterial plaque, dramatically boosts nitric oxide production, reduces inflammation, and restores healthy blood flow throughout your entire body, especially to your penis. I was honestly skeptical at first. We're trained in medical school to trust pharmaceuticals and be wary of natural remedies. But the science behind this is absolutely solid, and when I started recommending it to my patients, the results were nothing short of astonishing. Let me tell you about Thomas, a 62-year-old patient who came to me in tears. He hadn't been able to achieve a full erection in over 3 years. Viagra gave him headaches and only worked about half the time. His marriage was suffering. His confidence was destroyed. I put him on this simple drink protocol, 1 glass every morning on an empty stomach. Within 10 days, he called me excitedly to report morning erections for the first time in years. By week 3, he was able to have successful intercourse with his wife without any pills. He told me it felt like he had turned back the clock 15 years. Another patient, Robert, age 58, had spent over $12,000 on testosterone therapy with minimal results. After just 1 month on this drink, his erections were stronger than they had been in a decade, and he was able to stop the testosterone completely. So, what is this miracle drink? It's based on 3 key ingredients that work synergistically to reverse arterial damage and supercharge your vascular system. The foundation is pomegranate juice, not just any pomegranate juice, but pure organic pomegranate juice, with no added sugars. Pomegranate is one of the most powerful cardiovascular healers on the planet. Then we add a specific type of beetroot powder, which is the single most potent natural source of dietary nitrates that your body converts directly into nitric oxide. And finally, we include a measured dose of L-citrulline, an amino acid that further amplifies nitric oxide production and has been clinically proven to improve erection hardness. When you combine these 3 ingredients in the exact ratio I'm about to give you, you create a drink that quite literally starts unclogging your penile arteries from the very first glass. Here's exactly how you make it. Every morning, preferably on an empty stomach about 30 minutes before breakfast, you're going to mix 8 ounces of pure organic pomegranate juice with 1 tablespoon of organic beetroot powder. You can find high-quality beetroot powder at any health food store or online. Make sure it's pure beetroot with no fillers or additives. Stir it thoroughly until the powder is completely dissolved. Then add 3 grams, which is about 1 level teaspoon, of pure L-citrulline powder. Again, you want pharmaceutical-grade L-citrulline with no added ingredients. Stir this mixture vigorously for at least 30 seconds. The consistency should be slightly thick, deep red-purple in color, almost like a medicinal tonic. Drink the entire glass relatively quickly. Don't sip it slowly. You want those nutrients hitting your bloodstream fast, then wait 30 minutes before eating anything. This timing is crucial because you want maximum absorption on an empty stomach. Now let me explain the science of why this works so powerfully. Pomegranate juice is absolutely loaded with polyphenols and antioxidants, particularly one called punicalagin. These compounds have been shown in peer-reviewed studies to actually break down and dissolve arterial plaque. One study published in the Journal of Clinical Nutrition found that men who consumed pomegranate juice daily for 1 year experienced a 30% reduction in arterial plaque thickness. Think about that. This natural fruit juice is literally scrubbing your arteries clean from the inside. It also powerfully reduces inflammation throughout your cardiovascular system. Chronic inflammation is one of the major drivers of plaque formation. So by reducing inflammation, you're preventing new plaque from forming, while the polyphenols are removing existing plaque. This is addressing both sides of the problem simultaneously. Now, let's talk about the beetroot powder. Beets are absolutely exploding with natural nitrates. When you consume these dietary nitrates, your body has an elegant biochemical pathway that converts them into nitric oxide through bacteria in your saliva and enzymes in your blood vessels. This is a completely natural process that gives you a sustained release of nitric oxide for hours. Unlike Viagra, which forces a temporary chemical reaction, this is working with your body's own physiology. Study after study has shown that beetroot supplementation significantly improves endothelial function and increases blood flow. One research trial found that men who consumed beetroot juice experienced up to a 20% improvement in blood flow within just 2 hours. The effects are both immediate and cumulative. The more consistently you consume it, the better your baseline nitric oxide production becomes. The L-citrulline is the secret weapon that ties everything together. Citrulline is an amino acid that your body converts into another amino acid called L-arginine, which is a direct precursor to nitric oxide. Here's why we use citrulline instead of arginine directly. Citrulline is absorbed much more efficiently and isn't broken down by your digestive system the way arginine is. Multiple clinical trials have specifically looked at L-citrulline for erectile dysfunction. One Italian study gave men with mild to moderate ED 1.5 grams of citrulline daily. After 1 month, 50% of the men reported significant improvement in erection hardness and were able to achieve successful penetration. The researchers concluded that citrulline was a safe and effective alternative to pharmaceutical ED drugs. When you combine citrulline with the nitrates from beetroot, you're creating a dual pathway nitric oxide surge that's incredibly powerful. But there's even more happening in this drink. The combination of these ingredients also triggers something called angiogenesis, which is the formation of new blood vessels. As your existing blood vessels are being unclogged and healed, your body actually starts growing new capillaries and arteries to improve circulation even further. This is repair and regeneration at the deepest level. Additionally, the high antioxidant content protects your endothelial cells from oxidative stress, which is what damages them in the first place. You're not just treating symptoms, you're reversing years of vascular damage and giving your body the tools it needs to heal itself. Let me give you the exact step-by-step protocol. First thing in the morning, before you even have coffee or brush your teeth, prepare your drink. 8 ounces pure organic pomegranate juice, 1 tablespoon organic beetroot powder, 1 teaspoon L-citrulline powder. Mix thoroughly and drink within 5 minutes of preparing it. These compounds start to degrade when exposed to air and light, so you want to consume it fresh. Wait at least 30 minutes before eating or drinking anything else. This gives your body time to absorb and process the nutrients without interference from other foods. Do this every single morning without skipping days. Consistency is absolutely critical. Most men start noticing changes within the first week, but the full benefits build over time as your cardiovascular system heals. I recommend committing to at least 90 days to experience the complete transformation. Some common mistakes I see men make. First, they use pomegranate juice cocktails that are loaded with added sugar and only contain 10% actual pomegranate juice. This will not work. You need pure pomegranate juice. Read the label carefully. Second mistake is using low-quality beetroot powder that's been mixed with maltodextrin or other fillers. Always check the ingredients list. It should say 1 ingredient only: organic beetroot. Third mistake is inconsistency. Taking this drink 3 times one week and then forgetting about it the next week won't give you results. Your body needs that daily influx of these healing compounds to repair the damage. Set a morning alarm on your phone if you need to until it becomes a habit. Now, let me walk you through what you can expect as far as results and timeline. This is based on what I've observed with hundreds of my patients. Within the first 24 to 48 hours, many men report feeling a general sense of increased energy and blood flow. You might notice your hands and feet feel warmer, or you might feel a slight tingling sensation. This is the nitric oxide starting to work, opening up your blood vessels throughout your entire body. By day 3 to 5, most men experience their first morning erection in months or even years. This is a huge milestone. Morning erections are a sign of healthy vascular function and proper nitric oxide levels. It means blood is flowing correctly to your penis during sleep. By the end of week 1, you should notice improved firmness during arousal. Your erections may not be perfect yet, but there's a noticeable difference in rigidity compared to before. Week 2, the improvements accelerate. Erections become stronger, last longer, and require less effort or stimulation to achieve. Many men report that spontaneous arousal comes back, something they haven't felt in years. By week 3 to 4, most men are able to have successful sexual intercourse without any pharmaceutical assistance. The erections are firm enough for penetration and sustainable enough to reach climax. Your confidence starts to rebuild. You feel like yourself again. By month 2 and 3, you're experiencing the full benefits. Not only are your erections consistently strong, but your stamina improves dramatically. You can last longer. You have more control. Recovery time between rounds decreases. Some men report being able to perform twice in one evening, something they couldn't do even in their 40s. And here's a benefit I hear about constantly. Your partner notices. They comment on how much more present and confident you are. Intimacy improves not just physically, but emotionally, because you're no longer stressed or anxious about performance. One patient told me his wife said it felt like she had her husband back after years of distance and frustration. Beyond sexual performance, you'll notice other cardiovascular benefits. Your blood pressure often improves. Your cholesterol numbers may get better. You have more overall energy throughout the day because your entire circulatory system is functioning optimally. Some men report better workouts at the gym because their muscles are getting more oxygen and nutrients. The benefits extend far beyond just the bedroom. Let me give you a few bonus tips to maximize your results. First, stay well hydrated. Drink at least 8 glasses of water throughout the day. Proper hydration is essential for blood volume and circulation. Dehydration makes your blood thicker and harder to pump, which counteracts everything this drink is doing for you. Second, add in daily walking or light cardio. Even just 20 to 30 minutes of brisk walking every day significantly boosts nitric oxide production through a different pathway called shear stress on your blood vessel walls. Exercise and this drink work together synergistically. Third, reduce or eliminate alcohol. Alcohol is a vascular constrictor and depresses nitric oxide production. If you're serious about fixing your erectile dysfunction, limit alcohol to no more than 2 drinks per week. Here's what you absolutely must avoid. Do not consume processed vegetable oils like soybean oil, corn oil, or canola oil. These oils are highly inflammatory and directly damage your endothelial cells, undoing all the healing work this drink is doing. Read labels carefully because these oils are hidden in almost all processed and packaged foods. Avoid them completely. Also, minimize sugar and refined carbohydrates. Excess sugar causes inflammation and glycation, which is when sugar molecules bind to proteins in your blood vessel walls and create stiff, damaged tissue. This is the opposite of what we want. Cut out soda, candy, pastries, white bread, and sugary cereals. Finally, avoid chronic stress as much as possible. Stress hormones like cortisol directly suppress nitric oxide production and constrict blood vessels. Practice deep breathing, meditation, or any stress reduction technique that works for you. Let me share one more success story because I want you to understand how life-changing this can be. Mark was a 67-year-old patient who had given up completely on his sex life. He'd tried Viagra, Cialis, testosterone shots, and nothing worked consistently. He was embarrassed and had stopped even attempting intimacy with his wife for over 2 years. Their marriage had become more like a roommate situation. He came to my office depressed and defeated. I recommended this exact protocol. Within 2 weeks, he had his first successful intimate encounter in more than 3 years. He cried in my office when he told me about it. He said it wasn't just about the physical act. It was about feeling like a whole man again, feeling desirable, feeling connected to his wife. Last I heard from Mark, 6 months later, he and his wife were intimate regularly, sometimes multiple times per week, and they had rekindled a passion they thought was gone forever. That's the power of addressing the root cause instead of just masking symptoms with drugs. So here's what I urge you to do starting today. Get yourself high-quality organic pomegranate juice, organic beetroot powder, and pure L-citrulline powder. You can order all of these online or find them at health food stores. The total cost for a 1-month supply is usually around $30 to $40, a fraction of what you'd spend on prescription medications. Make this drink every single morning without fail for the next 90 days. Give your body the time it needs to heal and regenerate. Track your progress. Notice the changes week by week. And most importantly, be patient with yourself. You didn't develop vascular damage overnight, and while this drink works quickly, complete healing takes time. I truly believe that every man deserves to feel vital, confident, and capable in the bedroom, regardless of age. You don't have to accept erectile dysfunction as an inevitable part of getting older. Your body has an incredible ability to heal when you give it the right tools. This simple drink provides those tools. It's backed by solid science, it's safe, it's affordable, and it works. I've seen it transform the lives of thousands of men just like you. If this information has been helpful, please hit that like button and subscribe to this channel. I create content specifically to help men reclaim their health and vitality using natural, science-based approaches. Drop a comment below saying I'm starting today so I know you're taking action. Your comment also helps the algorithm show this video to more men who desperately need this information. Share this with any man in your life who's struggling silently. You could be changing someone's life. Please remember, this is not medical advice. Always consult your personal physician before trying any new remedy, especially if you're on medications or have underlying health conditions. I'm providing educational information based on my clinical experience and research, but your doctor knows your specific health situation and can guide you appropriately. Take control of your masculine health starting today. You deserve to feel confident, strong, and fully alive. This simple drink could be the answer you've been searching for.